Yes. So, welcome to our webinar called Sugar, Heart, Kidney. I'm Dr. Prajakta uh, from Healing Harmony Homeopathy Clinic. It is a homeopathy holistic clinic based in Malad. And I'm going to share my experience of my practice. It's been now 15 years of my practice, and what has helped in these chronic complaints and how they are interconnected, why it is, suddenly become a kind of a storm, no? So many people are suffering with diabetes and kidney complaints and a lot of hormonal issues that we are seeing these days, right? Okay. Let's make this webinar as a interactive session. Okay, so I'll share something. If you all have any queries, you can write down in the chat. I'll try to take that in between. Okay, but it will be very helpful if I know that whatever I'm discussing or sharing, and you all understand it. Okay. So I'll go ahead and share my screen. Okay. So the current statistics says that approximately one of every seven adults with diabetes, they globally lives in India. So the numbers are, increasing a lot about diabetes and the complaints of kidney and heart. These days we are seeing it a lot, right? Um, and it is somehow in terms of the heart complaints are also not age related. What we knew from our parents and our grandparents, that that used to happen at a very later age of life, but currently we are seeing that in the very young generation, very young people, they are suffering from heart disease, and suddenly we are seeing this unexpected death happening. So why it is like that? Let's try to understand. The WHO states that the non-communicable diseases, which are non-infections, okay, like these hormonals or organ related, they are more responsible around 80% of all the death. And these diseases, they are strongly linked to the risk factors, which include unhealthy diets, physical inactivity, excess body weight, and any consumption of tobacco, alcohol, like that. Excess amount of taking salt can also increase the blood pressure, right? And then it increases the risk of heart diseases like heart attacks, strokes, and other heart diseases. Overweight or obesity are the most important factor, the fourth most common factor for these non-communicable diseases in our region. And after the blood pressure or the addictions are concerned, one in four school aged children, they live with obesity or the overweight. And there is so much in the mind that how we can lose weight, or how weight loss has become something a very important aspect for for most of the people these days. 27% of the adults who do not meet the physical activity recommendations. Most of it, who can get kind of these diseases in your life. Now, what happens in diabetes and what is the pathophysiology? How does it get developed? Let's understand that. So, whenever we eat food, okay, it goes into our stomach, okay, it converts whatever we eat in form of our normal, dal, roti, chawal, anything, it gets converted into glucose. Okay. Now from there, the glucose, it comes into your bloodstream, in your blood. Now, once the glucose enters into bloodstream, our pancreas, okay, in Marathi we call it Swadupinda, or the pancreas which secrete the hormones, right? The hormone which is important for the glucose or a sugar metabolism is called insulin. You all must have heard the name, right? So that insulin, the pancreas produces. Okay. Pancreas, if it is healthy, it will produce a sufficient amount of insulin, which is required for this glucose to be used. Okay. Now, what happens is when the body or when your cells, okay, they are resistant, okay, to the insulin, the hormone insulin, what happens is the glucose is unable to enter into the cells. Okay, if you can see here, it is in the bloodstream, but the glucose is not going into your cells. And why do you need that in the cells? From there we get the energy, right? All the cells have the energy from the glucose. So in blood, there is this glucose, but insulin is secreted, but it is not utilized and it is not stored in the cells. So you don't have energy, but the blood sugar levels, it kind of increases. And when it happens constantly and this function, this metabolism get affected, you can develop and see the high rising blood sugars, right? What happens generally in healthy state, right? This insulin, which is secreted, there are these insulin receptors which are there on the cells, and there are glucose opening channels are there. Now, when the pancreas, they secrete the insulin, these insulins, if you can see here, they bind with insulin receptors which are there on the cells of our organs. All the organs will have multiple millions of cells, right? And these cells, their main fuel is glucose, right? So the insulin binds with the insulin receptor. After this process, the glucose channels which are there on the cells, they open up. And that is how the glucose enters into the cell from the blood stream and it gets stored here. And it is utilized for whatever we do. Like you're blinking your eyes also need energy. So that energy, you get it from the energy which is stored in your cells. Now, what is happening in type 2 diabetes? Okay, so diabetes mainly has two variations, type 1 diabetes and type 2 diabetes. What generally we see is the type 2 diabetes, which is the most common that we see. What is happening in type 2 diabetes is the insulin is there, the pancreas are secreting insulin, but these insulin which are there in the blood, they become, your cells, they become insulin resistant. So these insulin receptors are no longer accepting the insulin, and that is how the glucose channels are not opening. And the cells fail to respond to these circulating insulin which is there in our blood. And then that is how the blood has more of glucose. And we can term this concept as a, when the sugar levels are high, it is termed as a diabetes. Now what happens when you eat, say, very high fat rich food, very high calorie food? it can lead to obesity. It can lead to increase in your weight. With the increase of weight, after you have lot of, these high rich fatty food, there are these pro-inflammatory cytokines and chemokines. They get secreted. They're nothing but more of the hormones, right? They kind of they kind of secrete more pro-inflammatory and pathogenic material. Okay. And they can get deposited in your bloodstream, your arteries. Okay. How? Because there is this cytokine production and the macrophages infiltration happen at the level of your cells. And they get deposited on your blood vessels, in your arteries, if you can see here, which further will cause insulin resistance. These pro-inflammatory cytokines, chemokines, they cause insulin resistance. So overall, it is a kind of a back effect with your processed food or with your high fatty rich food. It generally happens with the in aggravating or increasing the insulin resistance of your cells. So all these factors, they contribute to have still affection of your sugar levels. Hmm? So what is the energy for everything? As I said, all the energy what we get is from our food. And from food, there's a digestion, and from digestion, we get that energy, right? But from how do we understand that? We generally say that, no, then let's not have a lot of carbs. We will cut down the carbs. We'll have more of proteins, right? Why? Whatever we eat, everything has carbs inside, okay, which is a primary source of our energy, right? But the high sugar in the blood stream, which we discussed, which happens in diabetes and in your also with your fat rich food, it kind of damages your other organs. Okay. And body at that time, because the cells are not getting glucose over there, they need to the body uses other energy sources. So they use there is a fat breakdown that happens, which can lead to ketosis, and this ketosis in eventually can also affect your very important organs, which is not very good, and it's one of the most complication of your diabetes, right? So what we need to do, we are trying to say that if we want to cure that problem, then just cutting the sugar or cutting the carbohydrates, it's not going to cure your complaint, because what you need to do to make your body help this insulin to come and get utilized, right? So the cause of the diabetes is lack of insulin or a lack of insulin or insulin resistance. So just cutting down the sugar randomly or carbohydrates is not going to cure the complaint. So we have to understand, go at a deeper level of that cause to be removed. Hmm? So when we understand diabetes is a hormonal problem. So just not taking rice, not taking sugar will not cure that complaint. It can maintain your sugar levels. And sometimes we see in the practice that still they do a lot of dietary changes, but still it doesn't help them, because it's a hormonal problem and the hormone is of insulin, right? And what happens that once the one hormone gets at imbalance, right, then it can affect on the other parts of your body also. So if you see diabetes, it's not only diabetes that only is present. Then people can have prostate enlargement, they can have infertility, they can have PCOD. So it is important when we see the diabetes as a you know a kind of a structure where there are a lot of diseases can be there because of the hormones. Okay. And these hormones can be affected, not only having sugar or not only having carbohydrate, but it can affect by having animal products like dairy, because it has a lot of other hormones when you take in the body. Hmm? Other hormone, non-organic foods or medications like steroids, oral contraceptive pills, they all have the hormones. And if you take those hormones, those medication consistently, those kind of a food, then it can again affect all the organs. And then because it's a hormone issue, right? And the hormone, all the hormones are secreted by the central nervous system, that the anterior pituitary, the organ. So it gets affected with all the parts and not just the one part. Hmm? The fat, okay, which is stored inside the muscle cell, can also cause insulin resistance. Okay, so we cannot just remove the sugar, but we also have to work on the oil, ghee, butter, and other animal product which has more fat content, which has more hormone content, like dairy, eggs. They're full of fats. The hormones are also stored in the fat. So hormonal problems will be more when you have more overweight or when you have more of obesity as a concern, right? Then what to do? If how to work on these fats and they how to get better effects of whatever we eat. So if you include lot of fibers in your food, then they can kind of hold on to the fat, right? And these fibers, they help to remove those fat out of the body, flush out of the body. And for main source of the fibers is through plant food, plant-based food, because only plants have the fibers. Okay, so if you have more of plant-based food in the whole form, as much as possible, it will help you to make your hormones more balanced. Hmm? So more whole food, not refining or processing, what happens? It reduces your fiber content. Hmm? So just say white, anything which is white, which is very refined, right? That has removed a lot of fibers. Most of the grain. Now we have an idea, right? That we are looking for organic food. We are looking for more raw food, more not refined food, right? Which help क्योंकि उसमें क्या है फाइबर बना हुआ है and that help for our fat, that help for our metabolism, that help our hormones. Okay, so taking fibers would be a good idea. Then we say, the first thing what we are doing, that we don't want to take carbs. I don't want to take carb if I'm diagnosed with something, anything like a chronic disease, I will not take carbs. But all the carbs are not bad. Okay. There are different variations of the carbs. What are those? There are simple carbs, there are starchy carbs, and there are complex carbs. What do you mean by simple? Simple means when you just take those carbs, within 50 to 30 minutes, your sugar will be, will be risen, and you will automatically you will start feeling good. Like our sweets, sugar, honey, chocolate, dairy will have these kinds of, sugars or the carbohydrates. But it lasts only for say 45 minutes or maximum by 1 hour. And then immediately you will start feeling again hungry or wanting to eat something because the sugar level goes down because it stays only for that short time. And then you'll again have something, then you'll again have something. But in contrast, if you take something which is whole grain, right, where the sugar are released at very slowly within 45 to 50 minutes, and it lasts for long, almost around 2 hours. So you don't feel much of, a craving or kind of a feeling of hunger a lot. And if you take, say, complex carbohydrate like legumes, vegetables, fibers, fruits, then it takes time for it to digest and slowly it kind of releases the sugar. And this this whole experience in the body lasts for long. So you don't feel that kind of a hunger or that kind of a craving to eat a lot. So if you focus to have more of complex carbohydrate, it will be helpful for you in your lifestyle. Hmm? Dairy and all its alternate derivatives, they all have fat, they all have hormones, they all have lot of chemicals like pesticides, PCBs, urea, antibiotic, lot of adulteration happen, and there is no fiber. Imagine the amount of uh, demand of milk these days. Are our cows are naturally producing these milk, and the and it is coming to us as a consumers from so many processes, and it has lot of these their own hormones. So when the when the cow secretes any milk, first of all, that milk is only for their calves, okay, for their children. But those, why? Because it is for their growth, like how we have as a humans, right? Our mother's milk, and that is sufficient for us for the entire growth of our life. Like that, the calf milk is for their children, but they are not getting utilized for that. And they will have their own hormones. And when we take that in our body, it kind of, create an hormonal imbalance a lot. Plus, there is a lot of violence, there are a lot of artificial insemination, a lot of chemicals are used. So the end result or the product that we get, it has a lot of these things which is not good for our body. And mainly we have seen that because of this, there are a lot of problems that have arisen. Stress. Now, who doesn't have a stress as this time? Every from small child to the uh, old people, everybody has stress. But how to manage that stress? How to deal better with the stress is something that we really need to work on. That can immediately can affect your blood sugar levels, to your hormones, to your the whole metabolism inside your body. So how to kind of deal better with your stress is also very, very important. Hmm? And nearly what we have seen, 50% of the Indian adults are unfit and fail to adhere to the WHO recommendation. So, to the adequate physical activity. And we really need to kind of, help ourselves do that in terms of getting better of these lifestyle diseases. Hmm? What does exercise do? It reduces the stress, and with the activity, it releases the very feel good hormones like serotonin, endorphins. And these hormones help to reduce the fat. So, choose any kind of activity, whatever you like, in terms of swimming, running, walking, Zumba, anything which you enjoy. I think that would really, really help you. Mhm. So now what is the association or relationship between this CKD, diabetes, that is chronic kidney disease, diabetes and heart disease? Okay. When one organ is not working properly, you kind of have a stress on the other organs, and they kind of get affected. Hmm? So if you see, if you have a high blood sugar, then there is a possibility for you to have high blood pressure. You see that if there is a genetic factor of or family history, then you are more prone to get that. If you are more obese, then you are more, likely to get blood pressures or blood sugar, high blood sugar. If you take unhealthy diet, along with all other factors, there is a possibility, of affecting all these hormones which affect your other heart and your kidney also. Hmm? So what happens that now let's understand how does heart function. So we know that heart pumps the blood which is with the oxygen, right, to our body. and then it supplies all the nutritions, and then the organs can function, they work, they're maintaining and they properly working, and then we stay alive. Okay. But heart at the same time, it also picks up the carbon dioxide and the waste products, right? That the body wants to get rid of also, right? Now, if and that blood move to each of your body, okay, through blood vessels, right? So together these heart and these blood vessels, they together make a system called the cardiovascular system. Okay, blood vessels with the heart as a functioning. Now the kidneys, our kidneys, they remove the waste and the extra fluid from our body. Okay, so they have functions like, they maintain our blood pressure, they control how much water in the body should be maintained. There are hormones that the kidneys secrete. Then there is some metabolic waste which is there, it has to flush out of our body through urine, right? Out of whatever the medicines that we take, it gets metabolized and excreted, and it helps. So there is not just one function, but there are a lot of other functions of the kidney through hormones, through their functioning of uh, removing the metabolic waste. It works wonderfully in our body. So if our heart is not pumping well, then your kidney, they're unable to have to work and do their removing the waste or getting the medicines filtered properly from the body. And if your kidneys are not working properly, they will kind of hold extra fluid, extra kind of a salt in your body, that is in your blood vessels, in your tissues, and this increases the pressure inside your blood, and that again affects your heart, because it is heart is also taking the waste products from your body and the cells, and is going into the heart back, right? So if you see the functioning of the heart, kidney, and other organs and hormones, they all are interdependent. So one, if it kind of gets affected, then you can have a cardiovascular kidney metabolic syndrome, right? The kidneys, they clean the blood, the waste products, and the extra water, right? So without the kidneys, the blood will have more of water and waste, and then heart would be working so much, so much, so much, and the kidneys are not working well, right? And then the blood supply which is going through our blood arteries or that blood vessels will also not be sufficient. They will not have the oxygen rich blood because all the waste is happening in our body. So they are unable to function their normal, required function to do. Everything will be, along with kidney and heart, both will get affected. So it can, heart diseases can lead to kidney disease, diabetes, obesity, or a vice versa. Yeah, so it's very important. So if you have a diabetes, it's very important you have to take care of your kidney and of your heart. The medications, they can help you to kind of work on the symptoms and maintain the blood pressure. But to bring that right balance and sustain that, we need to have the good working environment in our body, right? So if you have say arthritis, you will take some medicine, right? But that can cause some side effect in your body. So the second prescription can have, can which you are taking for your heart attack, that can damage your liver also. Then the liver trouble will come. Then it can those medicine can affect your spleen also. It is an ongoing process that can happen, and it can affect your system a lot by taking a lot of medicines and medicines and medicine. So what to do for that? How we can balance? our body very well. The lifestyle disorders, which we generally see these days a lot, with the common risk factors. But if you work on following things, it would really give you a best of effect. And whatever condition you are in right now, if you take a good whole plant-based diet, if you reduce the fat content, most of my patients I've seen, if they leave dairy, they become vegan, then there is a great possibility to have less of, digestive symptom and more of a hormonal balance. Complex carbs with high fiber diet can also help us as organic as possible, if there is a possibility, if you have that. Some exercise, movement of your body, because it helps for whatever we are eating. And our these days our job is mainly in front of the computers, mainly in front of sedentary type of work that we are doing, right? So movement is something very important. Whatever you like, you start wherever you are in your body, and whatever you enjoy, at least 3 times a day. Sorry, 3 times in a week is your must be your goal, and maintain that. Sustainability is more important rather than just doing sporadic. But no worries, even if you lose a track, if you are not able to do it, you went on a vacation and come back. Coming back would be very, very important to your routine or to following something which you really need to do that. Mental balance. So, the stress, how you can get the best of your feeling. Generally we see a lot of stress these days. How you can rejuvenate yourself. Like, we do a lot for our body, right? So that it can look nice, or it should have detox. We do a lot of things we do for our body, but we don't give much attention to our brain or our mind, right? Our feelings, our emotions. But activities like meditation, pranayam, all that thing help to rejuvenate at your mental level, emotional level. And help, if you really need any help to get all these things better, it's very important to find out that. So counseling, talking to somebody, taking help would also can help. What I've seen the best of effect with these chronic complaint and lifestyle disorder, many patients have improved a lot with all these things combining with homeopathic medicines. Why? Because homeopathy it's a very, very holistic science, okay? Because it supports your natural healing power. So when you give any medicine, they're very diluted. They're natural substance. They're prepared from plants, animal, even animal source, but in a way so that it just brings the energy, right? And it based on the like cure like principle. Okay, that means it produces the same symptoms which an unhealthy individual can have if it is taken, right? So, and very, very minute doses, very small doses, right? Like that. So, if you see, if there are any person who is having a allergic complaints, and allergic complaints with watery eyes and runny nose, and if you see during we are chopping the onion, we get that, right? And if we match those symptoms in a patient with these watery, runny eyes, sneezing, plus his mental level, then we can might give a remedy which is prepared from the onion to that individual. That is how the homeopathy is so natural and so based on the holistic science, right? So likes cure like is the most fundamental principle of homeopathy, right? And what it does, it helps your natural system, your body's natural mechanism to give the response and bring that balance, bring that harmony within yourself. They're prepared from very natural sources, very scientific process, step by step process, diluted, so they don't have any harsh effect on the body. They are it is mainly about the energy of that particular source that we use, be it a plant, mineral, or the animal discharges. It is further potentized a lot so that her energy is released. And that energy, because our body just don't need crude substance, like when we take anything which is very materialistic in terms of the form or in terms of the quantity is concerned, right? Because what we feel inside our body at a very energetic level, and homeopathy based on that. So it works with that energy, it activates that energy, our body's mechanism to bring that balance within. So a lot of chronic diseases, it has homeopathy help a lot when it is taken for these kind of complaint. Hmm? And they're prepared from the process of potentization. And each potency is 100 times more dilute than the previous one. So imagine the diluted part of it. So it doesn't give any side effects. Doesn't kind of affect your any other organs, unlike other system, but here it mainly matches with your energy. Hmm? And it is suitable to all, like even the pregnant women, the newborns, all age groups, even pets. I'm treating a lot of pets with homeopathy, and it really helps a lot. So if you see, our main aim is to balance the vital force, strengthen the immunity, and activate our natural healing power. And we have very ultra dilute sources. So only source remains in it. So no side effects. But if you see in Ayurveda also, they believe in a lot of natural and holistic. But there is the content, right? There is a crude substance which are kind of used, right? So they kind of based on the diagnosing and balancing these kind of doshas that we know, right? But long term help might not be highly recommended, right? But homeopathy can be taken for the long term, even if for chronic disease, it might need little bit more help in terms of the duration is concerned. Hmm? So it's not just in homeopathy, it's not just popping a pill. It's a system where we build a deep respect for how individual body and mind expresses the imbalance. So when we take a case or when we have to give any medicine, we just don't understand the physical symptoms. Because if you see, if I say if I have a headache, okay, I will have some pain. So it will be say around my forehead or around the temples. Okay. Some might have on the this upper part, some might have on the back part. But I'm having this kind of a pain. And the kind of pain is very violent, or जैसे हथौड़ा मार रहा है कोई ना ऐसा पेन हो रहा है. And with that pain, I am unable to hear any voice, any noise. I want to keep everything shut. I don't want light. And I'm just sitting in one place. And if somebody comes to talk to me, I will get irritated. I don't want to talk to that person. Or sometimes, there are people who are very angry during the complaint, or sometimes it's just weeping, or sometimes, they just want to kind of shut off everything and be in one place. So there are different reactions or different responses that come with one same kind of a headache. If you see, four people, if they are suffering from headache, everybody will have a different kind of the symptoms, different kind of experience, different kinds of mental symptoms also, if you can see that. So that kind of, homeopathy understand at a deeper level and find a remedy for it. Hmm? So it is based on the law of similars, right? Then minimum dose. So very, very low amount of medicine, only maybe a single dose, or depending on your um, disease, it requires that much amount of a dose, but very minute dose that we need. That we need. The medicines are also very, are made from a different kind of a process. It's called potentization, and it involves lot of dilution. with using the water and alcohol and vigorous shaking. And it helps to bring the energy of the medicine and remove the toxicity of that source. Right. So very, very minute dose with the maximum amount of energy. And we focus a lot on individualization. It's a very custom made, tailor made kind of a medicine. We talk to them, we understand, and we see that a different individual reacts and responses in a different way in the same complaint, right? Two children, if you see, they will not be same, no? If both of them have cold, one will be clingy, no, mummy ke saath hi rehna hai, and just crying. And other child would be very irritable, angry, doesn't want to kind of, he can throw tantrums, right? So we have a different remedy for that, how child responds, how child behaves. So pulsatilla remedy from the plant kingdom for the VP1. And bryonia is a remedy for somebody who is very irritable and thirsty. Right? So we don't treat diseases, but we treat people with diseases. And that changes everything. And that is how, your disease is also very, very unique and very individual to you. Right? And it is more of a holistic in nature, the homeopathy science. If you see PNEI axis, that is psychoneuroendocrine immunological axis. So it's like, the main your central nervous system, which kind of, holds onto your entire body, right? It works on your endocrine system, it works on your immune system. And when this PNEI axis, it comes into the balance, then there is a possibility to have the, the harmony within our cell, right? If you see, if you consider any musical instrument, say guitar, and it has a lot of strings to it, right? And if you see one of the string is also, not in the tune or not in the balance, the melody that you will get will be not very good to hear. But once you tune that string also, the melody which will come will be very, very soothing to your ear, or you'll feel very nice when you hear that. It's similar like that in our body. Any part of our body, small pain also, it will affect everything. It will affect physically, it will affect us emotionally, it will affect us mentally, it will affect our energy levels, right? You all must have observed that. But if you bring that energy, or if you cure that, the central theme or the central imbalance within ourselves, then the effect of it on the physic, on your emotions, on your mental, on your energy level will be balanced, just like that guitar. And that is what exactly the homeopathy medicines do. And it really helps at all the level because it works holistically. Even if you say diabetes, it's not just a system of where the sugars are less. It affects everything, right? So it needs a holistic treatment. Your blood pressure, your kidney disease, or any PCOD or thyroid, or anything which is related to hormones, because they have an effect on everything in your body, right? And that there the role of homeopathy comes in. Some myths about homeopathy, and I think that will give you some essence to understand the science little bit more. People say homeopathy is just a placebo. But if it is just like that, then it will not give the effects what we are seeing in the practice. Right? We have cured and helped a lot of colicky babies, feverish toddlers, anxious pets, unconscious patients. It would not give us result, or it will not sustain for so many years without having some effect on it. So it cannot be just the placebo, right? Hmm? So we've seen in the practice to work, so it can't just be a placebo effect. Hmm? It helps in more of your healing. Then people say that homeopathy, takes a lot of time to work. I just want to like kind of, take something which is very instant, instantly I want some results. But my friends, let's understand this, that if there are complaints, like, if there is, say, fever, or there is diarrhea, or there is anything suddenly happening which is coming within 24 hours or something of, or a food indigestion or food poisoning or something, high fever, cramps, teething, motion sickness, all of that, I will not tell you to wait for hours and days and days and days, right? If the complaint is coming suddenly or acutely, the homeopathy, if the right remedy is given, it can cure immediately. Within few hours, we have seen the result. They are more even faster in action even than the painkiller. And this is with my experience of my patients, what they have told me. But if there's a complaint, it's in so many years, you're suffering, say, in hormonal complaints. They're mostly chronic, coming from so many years. You're already taking medicines for long, but nothing is helping. And so you're coming to me with, you need to give time for the medicine to help and get it completely cured. It's safe for all ages and stages. Infants, pregnant women, elderly, all of them, right? Because it supports the body instead of suppressing it. And that is why it is trusted all across the generations. No side effects, no dependency. They will not cause you drowsiness, no liver load, no stomach issues, no hormonal imbalance, right? Because it empowers the self repair in your body and not kind of suppressing the symptoms. Okay. Plus, they are not addictive. So, even if you take for a longer time, it's not going to create any addictions for you. Hmm? And I want to kind of, help you all with this examples, what I have seen in the practice, that this was a 38-year-old male patient, okay? And he came, very panically, and because his heart age was showing almost 45 of his age. He had a lot of lipid or the fat metabolism concerns. Okay, so in the blood investigation, it saw his triglycerides were almost 583, where normals are around 200 or 250, like that. Hmm? And he was an early hypertensive. And with a proper case history analysis, and given him a lot of guidelines for diet, exercise, meditation, and he religiously followed it. The medicines, the detailed case history and taking, if you see, within 6 months, if you see, from 583, he was not on any medication. He trusted us, he trusted the homeopathic medicines. His daughter was under our treatment, so she felt much, much better with the help of the medicine for her acute complaints of respiratory complaints, and she used to have a lot of asthma and all of that. And he trusted us without taking any medicine, other medicines, only homeopathy with lot of lifestyle changes. If you see his triglyceride from 583 is almost within 6 months, it almost become less than half. He continued doing exercise, he continued doing um, the LDL cholesterol, if you see, was very high, 170. It is one of the not very good fat that is considered. That is also reduced, right? This can happen if you follow right homeopathy and with lifestyle. Lot of lifestyle changes. If your food, exercise, and you're taking care of your um mental state also. Another case, there are many cases, but these were very, very important and very nice. 48-year-old male, okay, he came up with sudden high sugars, almost 390 or something. And it was mainly related to his stress. So he used to work in the high pressure job and a corporates where, there was pressure was high, a lot of anxiety was there. And immediately it was shooted to 390. And then when the report he did, his HbA1c was 8.2, okay, which is less than 5 is considered normal. 5 to 6 is the, even if you're early diabetes, you'll have that kind of. And he had fasting sugar very high, 157. And post prandial, that is after food, was 286. And a lot of anxiety and the stress was too much. And with the, again, within 3 months, 6 months of the treatment, what you see, if you see the HbA1c, it came to 6.9 from 8.2. And the best thing was his fasting and his postprandial also reduced almost to half. And he continued the medicine and it really helped him. He was also not taking any other medicines of diabetes. But even if you are taking any medicines for diabetes, still there is a possibility that you can take these medicines together, and there is that what we have seen, that there is a slowly declining of the medicine content that you take from allopathy. And I've seen that patients happening. Your own doctor will kind of reduce your medicines. And it happened with the blood pressure, it happened with diabetes. Many people, who are on oral contraceptive pills or any hormonal, the hormonal therapy, we've seen the best of the result with if you follow this along with your homeopathy medicine and the lifestyle disorder. Really, really helped in my practice what I have seen. So at whatever level you are, even if you're just diagnosed, your family members are taking medicine for long, I think if you focus more of a holistic treatment for these chronic diseases, I think that would be a very, very helpful for you, for your family members, for your friends. And this is what I wanted to share with all of you. If you all have any questions, I'd be happy to take that. Any feedbacks, any questions, if you all have. Okay. For the dose, it's important. What has helped me, I'll tell you. When you take a case and you come to a remedy, a similimum, if it is based on more of an emotional level, you start with the basic 200 potency. What has helped me adding the LM, liquid medicine, liquid potency to it, has helped a lot of my patients. So if you start with 200 with LM continuation, it has helped a lot of our patients. Role of nosodes, I have seen more with constitutional treatment. It has given best of the result rather than giving anything in between, is my understanding in my practice. How to give LM? Okay, we can send you. We have some instructions for it. And I think if it is very easy to follow for the patients. So maybe you can write to us. We can send you all those instructions, how to take LM. Anybody else has any questions? Okay. So what we can do, yes, daily dose. We can do is we will share this recording with all of you. You all can go through it. If you have any questions, you all can write to us on healingharmonyclinic1@gmail.com. Thank you for joining. Bye bye.